Hi, Sally Walker here, your hormone and slow age expert. So welcome to this blog all about inflammation. It's quite a big blog. There's lots of various mini blogs. So we've got pain, we've got oxidative stress, we've got the omega-6 fatty acids, the omega-3 fatty acids, and the anti-inflammatory lifestyle. All very important mini blogs which you can dive into and get lots of information which may be more relevant for you. But this blog is all about inflammation in general, so the general terms, what it is, etc. So be sure to look at the other videos, be sure to look at the articles and educate yourself related to inflammation, which obviously is a very important part of the body's immune system. And we've got like two types of inflammation as such. We've got something called acute, and everybody is well aware of acute inflammation. This is the one that hurts like crazy, swells up, becomes red, maybe becomes hot, and there will be some kind of dysfunction, absolutely. So this is like when you've sprained your ankle, obviously, yeah. But then there's the chronic inflammation. So if you don't assist your body to heal your sprained ankle, then the inflammation could go chronic, absolutely, and you could get scar tissue and you're going to have permanent damage to that ankle. But most people would use the RICE principles, rest, ice, compression, elevation, at least for some days, and help the body fix and heal the tissue that got damaged in the sprain. But there's another type of chronic inflammation. We call it also low grade. We call it also silent inflammation. And this inflammation is going on inside the body. And many of the tissues inside the body don't have pain receptors, so you don't feel the pain. And as you can't see inside your body, you can't possibly see that there's some kind of swelling or redness, etc. And so we call it silent inflammation. You don't know it's there, and when you don't know it's there, you don't do anything to fix it, do you? And chronic inflammation is a killer. Yes, it absolutely is. It's at the root cause of all our symptoms and disease states. So we really want to know if we have chronic inflammation. Yes, we do. And how do you do that? Well, it's all about testing. And there are some articles and there are some little videos about how you test for inflammation. You can do this at home, but you're probably going to have your doctor involved as well. So anyway, check out this very, very important blog, because inflammation, as I said, can be a killer. We do not want to have chronic silent inflammation. We all want to know how we can deal with it, and it all starts with finding out if you've got it. So have a good look around in this blog. Happy hormones, happy life.